Claudia.
So, hi, hello, we're live.
Hi.
It's wonderful. So wonderful to have you here tonight. So,
Thank you, Claudia. Thank
you're
you for inviting
welcome.
me.
You're welcome. So, for our audience, I would just like to say I'm really happy to have you, Biljana Kennaway, here tonight with me in the interview. And we are really so lucky to be able to work with you at the Praxiszentrum Arcus. And I would ask you to maybe shortly introduce yourself. What is it that drives you every day?
Oh, likewise. I really enjoy working with you as well. And in particular because we have such a wide range of specialties and we exchange our experience and knowledge. And it reminds me a little bit of my work in London. So I started my career as a physio in London and I worked in some big London teaching hospitals. So there, not only that you learn from your colleagues, from your physios, that you work in a team, but also from dietitians, from speech and language therapists, your midwives that I learned a lot. So after some time of rotating through physiotherapy, I decided to specialize in pelvic health. And I really enjoyed it. So it's been now since probably 2006, 2007 that I've been in this specialty. But I never dropped the other parts of physiotherapy. So it's everything is so connected. All
True.
my women that come to me when they're pregnant, they're all either coming with some injuries in the shoulder, maybe back, or maybe they're very athletic, they would like to continue with that. Or sometimes they have some other complications, or maybe they have diabetes, and they would like, I need to be able to integrate all this knowledge from different areas to treat them.
So now, if we focus on the pregnancy, what would you say is like the most important thing for our pregnant or our mamas to be that are watching us tonight? What is it you would tell them to really watch out for and to kind of seek help or do prevention?
So I think that's very important is actually to stay fit and healthy. So pregnancy nowadays is actually much more supported with science in terms of exercise and pregnancy. So a long time ago, even when I was first pregnant myself, recommending exercise in pregnancy was very cautious. We had to be very careful what we advise our patients. But now we know that even if you haven't been able to exercise, because, for example, maybe you were very career driven. So when you're sitting in the office and you have sedentary life, and suddenly you don't have time to exercise maybe as much as when you are pregnant. I think that people usually find the time then to pregnant. So don't be afraid to take up an exercise that makes you happy, that you enjoy, and you feel the benefits afterwards. So I think we can all improve our fitness in pregnancy. That's one thing, and we can also improve our health in pregnancy. So it's the time when we're not looking after ourselves only, but suddenly there is a responsibility of our growing baby. And everything that we take in and everything we do, our baby is doing it inside our uterus at the same time. So the big intake is enjoy the pregnancy in a fit and healthy way, and ask for help if you are unsure if something is right to do, not right to do, if you're having any aches and pains in the back or the pelvis, or have any other discomfort.
Yeah. And I mean, can you tell us something about the benefits on the baby when the mom is really trying to stay fit during the pregnancy? What kind of research is there around?
I love you asking me that question. This is one of my favorite actually topics. So when I was first pregnant as well, lots of research for decades was focusing on safety of exercising and maybe safety for mothers and delivering the baby, but no one actually followed up what is actually going on with the baby. How do babies react to exercise during their development in uterus? So there were some studies going on in the States at that time. So now we're talking about over 15 years ago. Linda May and James Clark started studying the baby's development in terms of the cardiovascular development and also central nervous system development. So they found that exactly how we respond to increased exercise demand, so our heart rate lowers at rest, the same thing happens to the babies in uterus.
Oh.
So that is an amazing finding. And also the amazing finding is that these babies of exercising mothers, so now we're talking about mothers who exercise at least 2 to 3 times a week, and they actually exercise at least at the moderate level, if not at the high level. So with these babies in uterus, we call them exercising babies in uterus, their central nervous system also developed earlier. So in that way, maybe a few days they would be earlier also for a delivery. So that wouldn't mean that they are prematurely delivering. That would just mean they're ready because they mature, their cardiovascular system as well as the central nervous system develops quicker. And also they follow those children afterwards to 7 and some of them to 19 years of their life. They find the majority of them suffer from less from cardiovascular and metabolic disease. So those children, we think we are giving in uterus some predisposition and prevention of cardiovascular and metabolic disease.
This is awesome. I mean,
yes,
yeah.
And I think it's a simple exercise, like sit to stand, that is going to increase your heart rate, and it could be very beneficial for mother and a baby. Or simple exercises with arms sitting on a gym ball. So they don't have to be related to impact exercise or exercise that maybe is going to someone associates with hurting their back or the pelvis. They can be modified in so many ways. And you can give your baby already a preventative medicine for cardiovascular metabolic disease.
I mean, this is so amazing to realize once more how big of an impact it is on the unborn and newborn baby, the way we are leading our lives, and that it is so worth to really seek for a healthy lifestyle during the pregnancy. And us as midwives, we always talk about pregnancy and postpartum like a window of opportunities, of new opportunities, because we kind of more likely to, try something new and to basically step into a new way of a healthy lifestyle. Because as you said, we know that we don't just care for ourselves, but also for our little ones.
Exactly. Yeah. And I think you probably see that a lot during during assisting deliveries, that those women who have had some active life and active approach to their life in pregnancy, they go through childbirth in a little bit more prepared and easier way. Childbirth is not, it can't be predicted exactly when it's going to happen, what it's going to be like. But I always tell my women, just prepare. It's the most beautiful moment of your life, but prepare for being in this position, in that position. Have stamina, have energy, and you've seen it, how actually that is important.
Yes, definitely. And Biljana, if we now look forward to the time like after birth, when women are recovering, regenerating from birth, what is it they should watch out for in terms of pelvic floor health?
So in terms of preventing for any pelvic floor health, we know that there is evidence that antenatally, at any stage, whenever you hear about pelvic floor exercises, so they call them Kegel exercises, Beckenboden, perineal education, please try and find more information and contact your midwife or a physio, and we'll explain it to you. We'll assess you and guide you how to do it. it's important to start doing your pelvic floor strengthening when you're pregnant, if not even before the pregnancy would be even better. So in that way, we know that these women who are exercising regularly, they're reducing the risk of postnatal stress urinary incontinence. Even those who start experiencing stress urinary incontinence postnatally and they exercised antenatally, worked on their pelvic floor, still we found that these women recover quicker from any pelvic floor dysfunctions.
Yes.
So I think it's very important to address pelvic floor health, because this is the muscle that is affected by hormonal changes in pregnancy, by the weight that is changing in pregnancy, and then you're changing the muscles around the pelvis. The muscle activity or dominance of some muscles, the front, side, back, the hips as well, they're all going to be affected by the postural changes, by the weight and the growth of the baby. And then afterwards, this muscle is amazing muscle. This is what amazes me about pelvic floor muscle, is that during the labor, that's the only muscle that we know so far in our body that can stretch more than 3 times its size. And still is able to go back to its normal kind of function and length. So I think it's an amazing muscle that we can prepare for childbirth. We can prepare and prevent from any changes postnatally, and especially later on, it's important to carry on doing these exercises so we prevent later on in menopause when that muscle is again slightly touched.
Definitely. And, both of us know women who go to some, let's say, postpartum classes, and they have really difficulty to kind of control their pelvic floor. And they think by following the regular class, they can improve. What can you maybe point out to all the women that want to attend a regular class but are not really sure about their control of the pelvic floor muscle?
Okay, that's a really good question. And I think this is where I love working with you midwives who pick up lots of patients that need early contact with physio. So loads of women, especially in Switzerland, the trend is that once you give birth, then after 6 weeks or 8 weeks, they would start going through the Beckenboden training, which is fantastic. However, if there was someone who had 3rd or 4th degree tear, or someone who is really weak, they're going to really struggle following 60 minutes of pelvic floor training. And I know that it's not like the whole 60 minutes of just squeezing the muscle, but majority of time is dedicated just for that muscle. Now, like any other muscle in our body, that's the muscle that also can tire. So it fatigues, it strengthens, that muscle as well contracts, but also may have problems with release. So if you feel that the muscle is really weak and you really don't know if you're doing it correctly, we know that over 30% of women, when instructed verbally, are not able to contract it. Because it's either because of the strength, it's either because we learn differently. Some people are very visual, some people are very tactile, and so on. There might be lots of nerve damage as well, so it's very hard for them to feel it. So it's very important that we determine they're contracting in the right direction. Once we can determine that, then it's easy for us physios to say, now go back to your postnatal class or root building class and carry on with these exercises, but avoid some exercises. Keep for example, we teach them how many contractions they can do. In the class, if I have 6 women in a class, I know that all of them have totally different endurance and strength in the pelvic floor. So I can't instruct them with the same dosage. So that has to be really individualized. And I believe that pelvic floor strengthening in the big class is possible, but only when women are seen individually and they know that the individual prescription is 7 repetitions or 5 seconds and so on.
Yeah, I completely agree, because, you know, my experience is this, that when I did teach postpartum classes, women often do kind of not dare to ask or to say that they don't feel it or they don't really know what to do. And it's so difficult to, if you have a class of 6 or 8 or 10 women, to really support them.
And I think this is right. This is exactly what the problem is, that women don't always say, because either if that's their first pregnancy, they will feel embarrassed.
Yes.
But also they feel, oh, that's probably normal. That this is all that's going on in their head. Oh, it's probably normal. It's going to get better when I continue exercising.
Mm-hmm.
But then you know it very well that we had so many cases where women went to these classes, and because they were weak and they were so eager to get better, they worked so hard and they started having problems with release.
Yes.
So not always the problem is contraction. Often I get problem with release. So then I have to start releasing the muscle and teaching them how to release, and then start teaching them the right functional movement. And only then we can apply the strengthening principles. So
definitely.
It really varies how we approach pelvic floor training.
Yeah, definitely. And, you know, what I just wanted to say as well is, anyway, if there is like a weakness in holding the pelvic floor or releasing, it's, first of all, it's a difficulty because, you know, you have a problem going to the toilet or keeping your urine as long until you really sit on the toilet. But the problem is as well when couples want to restart having sex after pregnancy. This can be really a big issue for them, and potentially makes people very unhappy. So maybe, what is your experience in, you know, women experiencing difficulties, pain, or having a problem with relaxing for a nice intercourse? How do you work with them, or what is your advice for women who do have these experiences?
I think we see quite a lot of women being quite affected after childbirth, experiencing pain, and then because the pain maybe is very mild, they try to have intercourse, and they come into that act with enjoyment and excitement. But then, because we know after giving birth, the vagina is a little bit more dry. So first of all, we need to teach them actually that they would need probably a lubricant. Yes. Secondly, there might be a little bit of scarring there, and they experience pain. And that experience of pain of the first intercourse following childbirth, it gets quite embedded in their brain, and then the pain becomes greater. So what that means is that their muscle then becomes much more reactive to any even suggestion of intercourse. So for me, then the approach is basically working quite a lot on relaxation, and I use the methods of breathing. So we teach them to breathe, to inhale. I go through the stretching of the pelvic floor sometimes if it started getting also tight from holding and protecting the release. Sometimes I get women also to feel themselves. So I tell them, go where after you have a shower or whilst you're having a shower, it's totally normal to feel yourself, and then to feel that actually this is absolutely normal touch. That doesn't hurt, it shouldn't hurt. Yeah. So if it doesn't hurt, then you're feeding from the tissues, you're feeding into your brain that this is a normal touch, and that stretch doesn't hurt.
Definitely.
Sometimes I need to do manual therapy, which again is feeding into all these different paths and teaching the tissues that it's a friendly touch, and they just need to relax.
Definitely.
But then there are others, Claudia, I'm sure you saw that those who just lost the libido, and they suffer with actually any connection to baby and maybe a partner. But I'm very happy when they come and see us. I'm so happy because that means they really want to make a change.
Definitely.
But sometimes it's hard to reach out to those women. So often women would lose libido, but we can do something about it. So they should just come forwards, because
Yes.
it's a team of us that can work on it. And I've seen it change.
Definitely. So this is why I wanted to address, because my experience is that these topics are like hidden. And as I said in the beginning, potentially can cause a lot of unhappiness in couples. And what I also encourage women to do is, first of all, look at if they have a scar after the birth, to really look at it. And then as soon as it is not sore anymore, as soon as it has the wound has healed, to really start to touch again and to massage, and also to help the scar tissue to become soft and flexible again. And that already helps a lot.
Exactly. And it's like any other scar. If you don't touch, you're going to start getting a bit of scar tissue.
Yes.
But if you touch and if you move that scar, the scar starts softening and it starts healing in a much normal way. So we all have scars. I always tell my patients, you always have scar over your knuckle. And every time you bend, it starts bleeding and it starts kind of pulling or maybe itching. But eventually it heals, because we kept bending, because we have to use our fingers. So it's the same with any scar in any way, even C-section. So when I see women with C-section, the same, I can have the same problem, libido. I can have problems with pain around the C-scar, or pain below the cesarean section. And I always go for the massaging of the scar, which is very important, and they need to be doing daily, and then addressing the connecting it with the pelvic health. Because let me just show you something that I always have next to me. This is my little pelvic room. So I always tell my ladies that this is your pelvis. I don't know if you're going to see it.
Yeah.
And everyone always thinks that the pelvic floor just goes from the coccyx, so from your thigh spine to your pubic bone. But it doesn't. It goes from sit bone to sit bone. You see, from left to right.
Yeah.
So this is your back. And you see how the pelvic floor goes from the coccyx all the way here, but also from one sit bone to another sit bone. This is all the bundle of different muscles creating the pelvic floor. But what is very interesting is there are so many other muscles interacting with this pelvic floor. And starting from your gluteals that are sitting here at the back and giving you support around your the back part of the pelvis. But also we have all of the abdominals that are touching here on the symphysis pubis and oris, exactly where your pelvic floor starts. So I have all abdominals that are weakening in pregnancy, and they wrap us around. And then I have gluteals that also in majority weaken in pregnancy because of the postural change, because of all this gravity, central gravity moves forwards, and also hormonal influence. So I don't look just at the pelvic floor. I have to have a look how other muscles are interacting with the pelvic floor.
Definitely.
Especially if my women would like to go back to activities, such as playing tennis or running, lots of runners. Then I have to have a look how their body changed and how can I help them to strengthen different parts of the body that interact with the pelvic floor, so that we put least of a pressure through the pelvic floor and the organs that are supported by the pelvic floor, so that we avoid any symptoms of pelvic organ prolapse.
Yes.
And that may be another thing that we should mention. If after giving birth, postpartum, if women experience any heaviness or a feeling as if something is stuck inside, especially towards the end of the day, in the evening when they're standing still or if they've been walking, that probably is the sign that bladder, uterus, maybe bowels that need a little bit more support. So it just needs, we need to modify something to help you strengthen from the pelvic floor, from other structures around the pelvic floor and the pelvis, in order to give all the support before you start doing all these other activities.
Yes, definitely. I
So,
cannot agree more. You know, like my experience is that, especially here, I don't know how it is in other countries, but here, women are very likely to kind of come out of the hospital and then restart their social life right away. Now, it is special Corona times that was like reduced. So everyone stayed at home more often. And I see women recovering so much easier. I see babies being so much calmer. And it just tells me that we actually tend to overdo it, like, you know, being too active in the first, let's say, 2 weeks after the birth. I think in order to have your wound healed really well, it would be highly recommended to really take it easy in the beginning. And what I mean by that is also staying in bed or on the bed or on the sofa and not go shopping right away and having long walks and stuff. Having a short walk, yeah, perfect, to get some fresh air and move a little bit, but then take it easy.
I'm so glad you said it, because there
Mm.
are so many women nowadays that would like to, who are quite athletic, and they haven't. They think that as soon as they give birth, after a week or two, everything will be in place and they can
Yes.
carry on. For example, they would call me to teach Pilates in their house, and I would say, why don't we talk after 2 or 3 weeks?
Yeah.
Because usually, with any exercise, I always explain to them, and I have a lovely chart. It's not here, that I usually use for teaching healthcare professionals. Basically, I made a little clock, and
Mm-hmm.
clock goes to 12 months. And then I made a little labels to where the seconds go, and I put in the middle a running man, like a skeleton.
Yes.
And I always go to that clock to explain to my ladies, look, for uterus to go back to its size and weight, it takes 4 to 6 weeks.
Mm-hmm.
That's just one fact, because it's too heavy. It's going to be just like a weight sitting on top of your, or inside the pelvis. It needs to recover.
Yeah.
It needs this time to heal. But then we're talking about the soft tissues.
Mm-hmm.
If I know that uneventful, spontaneous vaginal deliveries will cause 30% of muscle damage. I'm not scaring anyone here. It's not like a muscle damage in terms of, wow, it's not repairable. It could be overstretched, it could be a little bit torn. It's 30%. If I know that 30% of these muscle fibers are going to be touched, then I know that I need to go through some healing time.
Yes.
And that healing time is going to take time. So soft tissues do need at least 2 weeks is initial stage, and then we're going to up to 3 months.
Yeah.
But we need to know how to load it. And it's not easy, because it's at the bottom of the pelvis, and you have a little one, maybe a toddler, you need to prepare food, you need to do this and that. So that's enough loading.
Yes.
And you even don't sleep.
Mm-hmm.
So this is where I always struggle to explain and to call them off, immediately thinking they can go for a jog, they can go for this, they can go for that. And a good thing is sometimes I just put them on single leg stand, and I tell them, like, by the time you can hop and we don't have any problems here, there, musculoskeletal, not even talking about pelvic floor, only then we can go running.
Yes.
So it's very important to understand that a load of things need to heal. And as a physio, as much as I love activity, and my job is to return them back to CrossFit, return them back to running, tennis. And recently someone was an Olympic weightlifter here in Zurich. So I helped her going back to her competition level. But the problem is, you have to understand, and if you're patient, we'll get you back to that.
Yes.
But if you're not, to go too soon, it might be actually much harder for us to get you back to your level of activity.
Yes, I completely agree, because especially, you know, sometimes you or women tend to, like, after birth, they feel that they are, of course, a little bit less fit than before. They just gave birth, which is a major event. And the response to it is like, let me start running now. I wanted to do it for such a long time. Why not now? And all these sports, if you have not done them before the pregnancy, it's actually not a perfect timing to start after the birth. You can start later on when you have fully recovered, like after half a year or even a year. But if you have not done running before, you shouldn't start running like 2 months after the birth. It's just early. Yeah.
No, I completely agree. And I think it really depends on the activity they would like to do and how much experience they had, like you said. For each activity, we need particular set of skills and strength. Now, if you don't have that, then I'm not going to be able to go and do that. So I have to strip like the activity they do in order to see if we can put it together and put them and ask them to do it. But the other point is that even if someone was running all the time before and even into the pregnancy, when they come postpartum, their body has changed.
Yes.
And you know what? One of my really good friends, son said, ask her, why does she have a little tummy? Is she pregnant? She says, no, this is not pregnancy. It's just extra tummy after I gave birth to you and your sister. And then he was only 5 years old, and he told her, that's mommy beautiful. What a lovely memory of having us in your tummy.
Yeah.
And you know what? This is what I like to tell all my women.
Yes.
Because media is destroying us. And talking about closing the gap with the abdominals and women doing abdominals inappropriately, too soon, too much, with at the same time when they're having pelvic organ polyps, is really wrong.
Yes.
So we need to gradually strengthen from the deeper layers and into the superficial layers, and we can gain the strength. But what is more important is that, we do it properly from inner to outer layer, and that we have a healthy baby and we get some sleep.
Exactly. That's the key, actually. I completely agree. And the thing is, there are some celebrities, and still we let ourselves be influenced from all those images where they kind of gave birth, and then you see them like 2 months later on doing the catwalk, and you think like, what? But, we do not know how they gave birth, until what week they went, how many personal trainers they have, and how healthy their body is in reality. We only see the pictures that most often are also touched. It's not like original, but it's like gone over with some Photoshop stuff. And
totally.
And we should really, really just start to take care of ourselves, start to like our bodies, love our bodies, how they are before the pregnancy, during the pregnancy, and after the pregnancy, because this is actually the key to make us eventually happy and satisfied, and also, in a nice harmony with our partner. Because if we do not like our bodies, how can we open up to our partners again?
Exactly.
Yeah.
And I think it's also important to, when you're pregnant, to understand that you are going through the changes, that you're going through the changes that are beautiful and are going to change your life to better. And if it takes 9 months for you to grow a baby, then it takes at least 9 to 12 months to get back to kind of feeling that you got your body somehow under your control. It may not be to what you wanted to be like, because you remembered one image before you got pregnant, but it's also the brain, because you fed the brain for maybe 25-30 years with one image, and then you got pregnant, your body changed. It takes time for the brain and for us to revert and to accept what we look like and what the changes have taken place. So I think we should more worry about getting the sleep and heal properly than really strengthen from inner to outer layer and prepare ourselves, have all components for the sport we'd like to do. And again, there is no prescription. One thing I'd like to say that I have someone I'm seeing currently now after her 3rd pregnancy, and I saw her after the 2nd pregnancy. She is now 2 months after giving birth. She is definitely ready for running. So I sent her for the first jog. She is totally different to someone else I saw today who gave birth in February, and she's not even ready to do the squats with me. as a
Yeah.
strengthening component. So
Yeah.
we're still working on neuromuscular control and waking up some muscles that just are a little bit weaker, and the other dominant ones take the place over them. So, and a lot of other things that are going on in everyone's lives that I need to take that into account, like you, Claudia, and like all our colleagues. So we are all individuals. There is no prescription when someone can return to yoga, Pilates, CrossFit, running, tennis. No, we are all individuals, and we need to be assessed and treated like that.
Definitely. Biljana, you know what? I would really love for you to talk a little bit about rectus diastasis as well.
Oh,
Just like, what is it? How can women perceive it? Or how can they figure out that they might want to seek for additional help?
Sure. So rectus diastasis is basically given a name because diastasis is separation. And you have a muscle that goes from your sternum, so from your breastbone to the pubic bone. So that's called rectus abdominis. So you have two bellies of rectus abdominis. And if I ask anyone, husbands, wives, little ones, children, to put their finger on the belly button, you will feel a little distance between left and right-sided rectus belly. Now that's normal. And we know that men and women have it. Women have a little bit more of the gap, maybe, before giving birth. And around the belly button, that structure in the middle that holds all the abdominals together is called linea alba. And that structure around the middle is thinner in us women than it is in men. But rectus diastasis anyone can get. Someone after surgery, could be a man, could be children after abdominal surgery or thoracic surgery. It could be after obesity. So there are various reasons why we could get. But every single woman in pregnancy will have to go through the process of this muscle separation, because the muscle will lengthen, and it can lengthen up to 25 centimeters. So you have a lengthening muscle, and to accommodate the baby, the growing uterus, then it's going to also separate a little bit. So that means that the structure in the middle, that linea alba, is going to thin as well. I usually demonstrate that, I don't have it here, with my TheraBand. So if you take the TheraBand from side to side, then it thins a bit. So it becomes a little bit weaker. Now, in some women, that structure can tear. And if it tears completely, then when you put your fingers in between the rectus bellies, you can go all the way down and you can almost feel your intestines. And in that case, usually there is no other help but the surgery. But until the surgery, we can do so many other things to make you feel stronger and look better and feel good and prepare you for the surgery.
Yes.
But there are loads of women that get scared because they feel 2 or 3 fingers in between the belly button. And they think this is a massive rectus diastasis. But the distance doesn't matter. It's about that depth.
Yes.
So if I can generate the tension in that tendon, so from breastbone to the pubic bone, and if when they do the curl and put the fingers around the belly button, and if at that moment you contract the pelvic floor or the deep abdominal muscle, and that tendon becomes tighter and harder, then I know we can rehab you. So for all the women, when you test yourself, when you do the curl, please don't panic about the distance. You have to think about the depth. So just have a feel, how far can you go? Can you change the depth by using the pelvic floor or the deep abdominal muscle? Because one part of that tendon is made of some fibers from the transversus abdominis. So this is how we know how we can help. And again, the exercises are not general. So it really depends where the diastasis is. We need to prescribe these exercises individually. I usually just keep my fingers around to feel where the activity is coming from, what is going on with the tendon, what is going on with the muscle, and this is how we go. But lastly, I need to tell. Sorry.
Tell me. No, that's okay.
Most of my ladies come and they ask me. They expect quite quick recovery. But the rectus belly is being stretched for for maybe 10 centimeters, but it takes time to get back, so we need to get some contraction going there. So I always have to tell them, you need to commit at least 6 months to see the change, maybe 12 months to get the recovery.
Yeah.
So if we find an agreement here and we put things in place to properly exercise, but that means I really need a commitment 3 times a week. And often with rectus diastasis, I ask them to go for a fast walk without the buggy, so that the arms and opposite leg, this is where you're kind of creating a force. So there's a force across the tendon and the muscles. So that is also going to feed the tendon and get and speed up the recovery. So there are lots of little things that we need to put in place before we can see the recovery. But please don't jump into the surgery, because it's massive, painful, and recovery is much longer than taking step by step with us.
Definitely. Biljana, if women want to get in touch with you before or after the birth, how can they reach you?
Well, they can find me in Praxiszentrum Arcus. I'm there 2 days a week so far. And then the rest of the time I'm in Solicon. But my website is www.bkennaway.net. There is my email address and my contact number. So you can email me, that's the best thing to do, or email me via our website, or you can call me directly on my number.
Yeah, perfect. I will put everything in the show notes afterwards.
Thank you.
And women who are connected with me somehow, they of course can also go through me to connect with you, because we are sending each other patients all the time. We're working together very, very tightly, and our goal is really to support women health throughout pregnancy, birth, and postpartum. This is like what we really burn for.
Exactly, and this is where I found a difference working in Arcus. It's because most of my patients come from you and the gynecologist, Dr. Bernardi, but it's because you see women as soon as they give birth, you're able to alert me to ladies that need our attention early, and then I can get them right in on time, and they may not come from the gynecologist that maybe I work with. It may be totally different gynecologist, but at least I'm there step ahead and asking the gynecologist, please have a look at that. I think we need to address a couple of issues. We need to go and start the rehab early, because what's a gynecologist? First of all, women go for the 6-week checkup. They don't always communicate all their symptoms.
Yes, yeah.
And that's the first thing that I discovered. The second thing is gynecologists don't always ask, because they expect that the women will say. So we have this miscommunication sometimes, and kind of the trust that is falsely built between two.
Yes.
And this is why I really love, and I think it's important to work with midwives, especially here, because we get to help women early, so they don't get with these symptoms later in stage when recovery is harder and much longer, or someone already talked to them about some surgeries that are totally unnecessary.
Definitely. Listen, do you have like a take-home message that you really want women to take out of this interview? What is it that you say this is so essential? If you forget a lot of the interview, keep on mind this certain point. Could be 1, could be 3, whatever comes to your mind.
So my first point really is enjoy your pregnancy. And I know some women will say, how can I enjoy? I'm feeling sick. Some will say, how can I enjoy it because my other pregnancy had such bad memory and experience? Please, if you have anything like that, contact us. There are so many people out there that we can help you. But I get really saddened when my women come and see me in pregnancy, and when they tell me they can't wait when this is over, they are not enjoying it. And my job is in a team to always find the right person to help them, because it's only 9 months, the most beautiful moment in your life, when only for 9 months you get this opportunity to grow your little being And afterwards they come out, we have them for, I don't know, 17, 18 years, and they just leave us.
Yeah.
So 9 months, I'd like everyone to enjoy. And I remember my first pregnancy, I was with a bump and I was talking to my bump all the time. And when it was time for delivery, I was like, can I just hold him a little bit longer? And just, he's got too many secrets now between us.
Yeah.
It's a lovely time. And all the changes that we experience in pregnancy and our partners need to put up with it, I think they're hilarious. Take a little journal, write it down, take your partners to write down some hilarious things you said when you were pregnant, and just enjoy it, laugh at it sometimes. It's a beautiful time.
True.
And we can make you go through it easier if you have aches and pains, if you have fear, if have different expectations that maybe someone else was telling you. Just come and talk to us and stay active. Even if you haven't been active before, be active now.
Yes.
It's never too late, and you cannot harm yourself or a baby. You can just help your baby.
Yeah.
And lastly, I would say, don't forget your pelvic floor. It's right here. You need it until the end, until the end of the pregnancy. Carry on doing it, and as soon as you pass your first urine, please get on your pelvic floor again. See how can you gently squeeze and release.
Perfect. Hey, Biljana, I thank you so much for this precious interview. It's so full with important information, and I really hope all the women that see it can take out the message that really concerns them, and really translate it into their pregnancies, into their postpartum time, and seek for help timely so that they can recover speedy and have, a healthy, strong body and feel well. So,
Exactly.
so I wish you a great evening, Biljana. Everyone who is watching us, I wish you a wonderful evening. And thanks for listening. Let me know if you're welcome. Let me know if any questions come up for you. I'm happy to answer or to forward your questions to Biljana if you see this interview later on. And all the best. Thanks, Biljana.
Thank you.
See you.
Thank you.
You're
Enjoy
welcome.
pregnancies. Bye.
Thanks. Bye.